We're doing upper left, lower left, so that is an eyelid lift. Let me know how the quality is here. Been having some issues with our Instagram, but we're just getting started and we're live here on our YouTube as well. You can join us over there at Dr. Jeneby Plastic Surgery. Over there we are showing the patient surgery and showing Dr. Rocket. Just got started a few minutes ago. So if that's something that you're interested in, again, you can find us at Dr. Jeneby Plastic Surgery. And over there, we flip the camera. Hope y'all are having a good morning so far. And we are answering questions. So if there's any silly questions or any questions at all, feel free to comment those down below. I'd be happy to answer those for you, or have Dr. Rocket answer those for y'all. Again, we're just getting started. This is Dr. Rocket's first case of the day. We have two total. His first case is upper left and a lower left. So we are doing an eyelid lift. We're doing the upper eyelid and the lower eyelid. And we are, for our second case, we are doing a tummy tuck and we are doing a removal and replacement of some implants. So we may or may not go live for that one. If you don't want to miss out, you can follow us and then it'll notify you anytime that we do go live. So I hope y'all are having a great Tuesday morning. I definitely am a little tired, but so far so good. And again, for those of you who are curious, you can join us on YouTube. Over there, we like to show our surgery. So we flip the camera over and you're able to see our surgeon, you're able to see our patients and the area in which we are operating on. If that's something that interests you, again, Dr. Jeneby Plastic Surgery on YouTube. On that platform, we go live for all of our surgeons here that we're networked with. So Dr. Rocket, Dr. Latin Heat, we've got Dr. Howe, and we got Dr. Bam. We all go live on the same YouTube. For those of you who are curious why we go under Dr. Jeneby, we just go off of the same YouTube there. But again, any questions about pricing, setting up a consultation, any questions on the services that we offer, feel free to leave those down in the comments here. We have two today. We're live for this one. We'll be live for a little while, but then we may or may not go live for our last one. So stay tuned. Again, you guys just want to give us a follow. It notifies you anytime that we do go live. So definitely consider that. Again, if you want to see the camera flipped, you can join us on our YouTube. Over there, you'll be able to see our patient, our surgeon, and the procedures that are going on. So again, Dr. Jeneby Plastic Surgery on our YouTube. Again, Dr. Jeneby Plastic Surgery on our YouTube. If you want to see the surgery, our surgeon, and the procedure. But again, thank y'all for joining us. We are doing an eyelid lift. So we are removing that fold on the upper eyelid due to age and losing skin elasticity up there. It begins to sag. So we're going to go in and remove that fold, that unwanted, undesired fold that kind of makes people look tired and groggy and just, you know, it's not very aesthetically pleasing. And then on the bottom here for the lower lid, we're going to remove some of those bags and just kind of flatten it out, make it look give a younger appearance. So again, any questions about the services that we offer here at Maximus, the services that Dr. Rocket specializes in? Comment those down below. Be happy to answer those for you and would love to. Dr. Rocket has been featured on TLC on a skin tightening show, and during his time being featured on that show, he specialized with patients that came in who had lost a ton of weight and had a ton of excess skin and were looking to get that skin removed and rejuvenated, basically. So Dr. Barlow sees a lot of patients that have lost a lot of weight and are looking to return back to like a normal, I guess give it a normal natural appearance. So removing the excess skin. He does a lot of lifts, thigh lifts, arm lifts. We'll see a lot of tummy tucks and things like that. All of our surgeons are a little different. Obviously, they like and prefer different surgeries over others, and they specialize in different things. But Dr. Barlow here, he does specialize in patients and surgeries that our patients have come in to having lost a lot of weight. Just an FYI. Thought I'd get that out there. Again, we're on our first case. Dr. Rocket has two today. The first case, again, is a upper eyelid lift and lower lid lift. And then we have one more case later today. Right after this, we are doing a tummy tuck and a removal of some old implants and a replacement. So we're going to add some new implants. So tune into that live if you're interested. Dr. Barlow here travels between Houston and San Antonio and operates in both cities. So we don't get to go live with him as often as we would like. So take advantage of his time here. Again, for those of y'all who are just popping on, we are doing an upper eyelid lift and a lower lid lift on our patient today with Dr. Rocket. So we've been live here for a few minutes now. A few minutes into our surgery. It is going well so far. Dr. Rocket is on our patient's right side, doing the right eye first. So he's starting off with that upper lid, and he's going to remove some of that skin and stitch it back up. That's going to give the lifted look, make it look like there was no, there was no sagging skin to begin with, and they intentionally put the scarring, or the incision and the stitches right in that fold where when your eyes are open, you're not able to see it anyway. So that is that. If y'all are interested in taking the next steps and booking your consultation and asking our team here what we do for our, how we do post-op, pre-op, what you can expect, you guys can fill out this form form that I have pinned on the bottom of your screen is going to be that blue little dot. You'll just fill that out. Someone from our team will receive it, go over all that information, and then reach back out to you either later today, in the coming days, and from there we are able to move forward. So that's setting up your consultation, getting payment scheduled, answering any questions that you may have. Sometimes our surgeons like to just consult with you, obviously, to make sure that you are healthy, first of all, to be going under surgery. We like to calculate your BMI. We like to see what surgeries you would like to do and see if we can pair them up together. So that is something to consider as well. But again, y'all, our first case, we are doing a upper eyelid lift and a lower lid lift. So any questions, any comments, questions, concerns, leave those in the comments below. I'll be happy to answer those for you, or we can ask Dr. Rocket himself. Thanks, Libby. Lydmila from Galveston. Thanks for the follow. Hope you're having a great day. Still doing the right eye, then we move on over to the left eye. Good morning, y'all. Some aging, so that's what Dr. Rocket is currently working on right now. Later, we do have another case. It is a tummy tuck. We are also going to be doing a removal of some old breast implants and a replacement. So we're going to take out the old and put in some new ones. So stay tuned for that. Also live on our YouTube if you would like to join us over there. We are able to show the surgery, show our surgeon, and show the patient's area where we are doing and operating, where we're operating on. So if that's something that piques your interest, you can find us at Dr. Jeneby Plastic Surgery on YouTube. There, we like to go live with a few other doctors, so don't let the name confuse you. We still go live there with Dr. Barlow, Dr. Brachiopplasty, we go live with Dr. Matt Heat. A lot of friends and family, loved ones, you name it, they like to join us on our YouTube and watch the patient's surgery. It's kind of like being there and watching over them, I think, in essence. So, you guys are welcome to join us over there as well. Again, for those of you just joining us, we're doing an upper left and a lower left. So what that is an eyelid lift. So the upper fold that you'll see on an eyelid, we are going in and removing that to give it a more cohesive appearance, obviously lifted look. We're also going to go in and do the lower left. So what that looks like is removing, reducing the bags under our patient's eyes. So those, again, those lines and those folds that you begin to see, we're going to go in and try to flatten those out. Let me know how the quality is doing over here. I can see I'm like glitching a little bit, so just let me know. This phone may be getting a little hot, so just let me know how the quality is if it is bad. Hey Megalina, how are you? Thanks for joining us. And thanks for the like, we appreciate it. Again, we're still on our first case. We are doing a upper left and a lower left. So that is an eyelid lift. Let me know how the quality is. I can see I'm glitching a little bit, so I wonder if the sound is off, if it's sounding glitchy at all, just let me know. It's great on my end. Okay, good. Maybe it's just this phone. I don't know. Well, but thanks for letting me know. Oh, thanks. We appreciate it. Again, hope y'all are having a good Tuesday. Dr. Rocket is still on his first case, so we are doing a upper left and a lower left. So again, that is an eyelid left. Dr. Rocket is still on our patient's right eye. Getting right here to switch. Oh, thank you, Magdalena. We really appreciate that. How's your morning going so far? Brother just joined the Navy and he's in Pensacola right now, so hopefully I'll get to see him. Pensacola also. Cool. Neat. I love that. I know. I haven't been to Florida before, and I hear the beaches are amazing. again, for those of you guys tuning in, we are doing an upper eyelid lift, a lower lid lift, and we are live on our YouTube. Join us over there at Dr. Jeneby Plastic Surgery. There, we show the surgery, we show our patient and our surgeons. Still on our first case. Later today, we'll go in and do a tummy tuck and replacement of some old implants. The left eye. Live here for about 20 minutes, so we've been in DOR for a little bit longer than that, about 25. We'll be live here for a few more minutes, and then we will go ahead and take a break. Dr. Rocket does have another case later today. He will be doing a tummy tuck and a replacement of some old implants, so a removal and a replacement. So if you'd like to tune in to that, give us a follow. It'll notify you anytime that we go live. Again, so what this procedure looks like is Dr. Rocket usually will start on the upper eyelid. Well, it will already be marked where they need to remove those extra folds and that excess skin. And so they'll go ahead and cut where they need to remove the skin and basically remove it, and then they'll go and stitch it up. And so for the lower lid lift, they will make an incision on the lower lid, right under the eyelashes, and they will use a tool to kind of flatten out the fat that sits in your lower lid. And from there, what happens is, once they kind of flatten out that fat, they will stitch it back up. They usually try not to remove any skin, if possible, from the lower lid, because that can cause conditions where the eye is exposed for too long when resting or when the eyes are closed, and your eyes will basically dry out and will be damaged if they are dry for too long, and your eyes need to be lubricated, and so when they're closed they are able to do that, obviously. So that's something that we try to avoid if possible. Sometimes some skin is removed from the lower lid, but usually we try to refrain from that and do other options, but it just kind of depends. It's at the discretion, and again, what is best for the patient. So that is something to consider as well. I didn't know that really. So what gives it that lifted look is flattening and kind of scattering that fat like an apron, so to speak. Again, this is the first case of the day, so we will be live later this morning. So give us a follow if you're interested, and we'll give you all the details on what's going on later. And so we're still on the right eye now. We're just doing some last stitches, and we'll go in on the left eye, do the exact same thing that we did on the right side, but just on the left side. Hello there. We are still on our first case with Dr. Brackett. We are doing an upper lid, lower lid lift. Yay, yay, yay. Hey there, Sincere. How are you? Again, we are just doing some stitches on our patient's arm right now, and then we're going to hop over to our patient's left side and finish up. I'm fabulous, so glad to get to see you all. That is so sweet. Well, we're happy that you joined us today. Having a good Tuesday morning. We are here. It's a little rainy. It was raining very bad last night. We're gonna work okay. Well, thanks for joining us and tuning in. Will you be coming here to Maximus or Chrysalis? Oh, I see. Hey, if you're ready to take the next steps, we do have this form you can fill out, and it's basically to help us figure out what you want. And we can help you schedule a consultation with one of our surgeons, virtual or in person. So if you're ready to take the next steps, feel free to fill that out. Be happy to set you up with someone from our team, talk about finance, and scheduling your appointments. What are you interested in having done, Sincere? If you'd like to share, of course. Yeah, of course. Let me know if you have any questions. That is what I am here for. That is the whole purpose of these lives, is to just kind of equip you guys with some knowledge and give you all an opportunity to ask any questions. Yeah. But again, y'all, we are doing an upper and lower lid lift. So we're just doing some stitches right now on our patient's right eye, and then we're going to hop on over to the left side and finish up there. Do the exact same thing that we did on the right side, on the left side. We're also live on our YouTube as well. It's going to be Dr. plastic surgery if you want to see the camera front. We're live here for a few more minutes, and then we're going to take a bit of a break and then come back. So I'll give y'all a few more minutes if you'd like to ask any more questions, and then we'll go ahead and wrap it up. Again, if y'all are interested in taking the next steps in scheduling your consultation and scheduling your procedures and inquiring about financing and other things and other services that we offer, again, y'all can fill out that form that I have pinned on the bottom of your screen. There's going to be the Get a Quote button in our bio. Once you fill it out, we're able to set up your consultation. That is the first step. It's just consulting with our surgeon or coordinator what would be best for you and your desires. Moving from there, we go in and we figure out financing, we figure out what surgeon you are going to go with, and we are able to move in the process of getting you from the DMs to the OR. So again, if that's something that interests you, it's going to be that form here on the bottom of your screen. But we're going to just take a little bit of our next surgery, so we're going to just take a little bit of a break and come back. And again, this was our first case, and we'll probably be live for our last case, or second case. That is going to be a tummy tuck and a removal of some old implants and a replacement. So we're going to remove some old ones and then add new ones. So that is our second case of the day. So y'all should stay tuned for that. And then we will come back. We'll go live again, and that can give y'all another opportunity to ask any questions you may have, and other services that we offer, or if you guys would just like to if y'all would just like to reach out to us privately and DM us, you can. We do answer questions there as well. If you have a more private